Hello everyone, welcome back to Fire Nursing Tutorial YouTube channel. In this class, we'll discuss very important topic here, bacterial infection versus viral infection. Who all have visited first time on the channel, please do subscribe and watch. We'll see bacterial infection versus viral infection. First, we'll see what is infection. Here, infection is the entry and multiplication of harmful microorganisms inside the body, which may cause disease. What happens here? Infection is nothing but there will be the entry and multiplication of pathogens inside the human body, and then which gives rise to disease, which is going to cause disease. Here we'll see bacterial infection. Bacterial infections are caused by bacteria, which are single-celled living microorganisms. They can survive on their own, reproduce quickly, and some types can cause disease in humans. That is bacterial infections, of course, caused by the bacteria. And then next comes to the viral infection here. Viral infections are caused by viruses, which are smaller than bacteria and cannot survive or reproduce without entering a living host cell. Host cell like a human cell. This is viral infection. Next we'll see in case of fever. In case of fever, bacterial infection, here what happens, viral infection, what happens in case of fever? Bacterial in the sense often high and persistent. And then here viral can be mild to moderate fever we can see in the viral infection, in the bacterial infection about fever, regarding fever. Next, cough. Bacterial infection may produce thick mucus. And then in the viral, usually dry or mild cough we can see. Next, pain also here. Pain in bacterial infection, localized pain we can see. Local part we can see. In the local part we can see pain. And then here, in the viral infection, body-wide aches. Full body-wide aches are present. Next, we'll see the fatigue. In case of fatigue, bacterial infection, sometimes present. And then viral infection, common and often severe. It's always present in viral infection. Next, duration. Bacterial infection may not resolve without treatment. Treatment is mandatory. And then in viral, often resolves in 5 to 7 days, even though not taking treatment. Next, diagnosis. Here, bacterial infections are usually diagnosed using blood, urine or culture tests. Viral infections are diagnosed using PCR, antigen or antibody tests. Here, P.B.Bsc test. For bacterial infection, neutrophils increased. For the viral infection, lymphocytes increased. And then CRP. Here, CRP test, that is bacterial infection highly increased. And then viral increase but low. Comparatively, bacterial infection. Next, culture test. In comparison, bacterial versus viral. Bacterial, seen growth, and then viral, it's not at all applicable. And then comes to the PCR or ELISA. That is bacterial, not applicable, and then viral, special use. Next, we'll see the treatment. Bacterial infection. For the bacterial infection, antibiotics like amoxicillin, ciprofloxacin are used, okay? And then rest, fluid and diet control is mandatory. And then severe infections may need hospitalization in bacterial infection. In case of bacterial infection, hospitalization is needed. Next, we'll see the viral infection. In case of viral infection, in comparison to the bacterial infection, no role of antibiotics here. Antibiotics won't work. And then antiviral drugs only for specific infections like herpes, HIV or influenza. And then mainly symptomatic treatment. Okay, symptomatic treatment can be given in a viral infection, not in a bacterial infection. Like fever control, hydration, and then rest. I hope you all are clear with the bacterial infection versus viral infection. Please like, share and subscribe to our YouTube channel for more information. Thank you for watching.